Well, one thing that sort of stuck out to me was that you mentioned sort of actionable items and actionable data and things of that sort. So, what are some of the main, and you kind of alluded to it a little bit at the beginning of our conversation, but what are some of the main actionable data collections or things that you'd like to collect through StrivePD? Just talk a little bit about some of the things that you feel as though are at the top of the list to collect for these patients.
Sure. Well, this is where the precision neurology side comes in. We know there's many common things that people with Parkinson's experience, but no two experiences are alike. So we know that many people with Parkinson's don't experience tremor. We know that people should exercise, but what exercise should they do and how long should they do it for? So I think the most important aspects of Parkinson's is to collect what is the patient not able to do? If they want to go golfing and they're having off time, how can Strive PD collect this off time and how can we look to see if certain PRN medications are really reducing that tremor so that they can actually golf or they can go to dinner with friends? So I think it's important for patients to use the app to focus on what brings them joy and quality of life. Sometimes tremor and dyskinesia don't bother the patient. So I always try to tweeze out what do you want to do that you can't do anymore? And a lot of it has to do with, going out in the boat because they're scared of falling. And so when they report on certain symptoms that bother them or reduce their quality of life, they can start looking at the pattern. We can look at the pattern together and we can try to correlate what happened on your best days and what happened on your off days. And so the more the patient can log, the more Strive PD can compare and contrast, weeks to months to see if we can find a pattern so that we can reduce these symptoms. So, for example, maybe a patient sees that on the weekends their symptoms are worse, and they find through Strive, we have a graph that shows them when they take their medications and when they exercise, and maybe they aren't going to a formal exercise class on the weekends, or maybe they're not as adherent to taking their medications because they're out and about with their family and friends. So that really helps us hone in. We now have medications that were just approved to, levodopa to be taken twice a day. So if there is something that we can do to help them with medication management or with off time, we can have that discussion together. And what I think is extremely valuable is that we just implemented a new feature that has been released, and they're auto-generated reports. So we use a large language model. I know the big buzzword of AI, but we use these models to help synthesize all the data that patients collect. And it's a lot over 3 to 6 months. And these reports are sent out to all of our users monthly. So over 10,000 users get a very personalized, curated report. And what it does is it compares the prior month to the most recent past month. And it trends out changes in tremor and their mobility, how much they exercised last month versus this month, how adherent were they to their medications. And these reports are easy for them to read, easy for them to download, and easy for them to share with their clinician at their next appointment. So I think really having those changes be very evident can help a clinician and the patient really make the best decision for them.